I think that we can work on improving the care of mothers and babies of non-English speakers by continuing to assess our community's access to appropriate and accessible interpreter services. The access across our state appears to be quite different. There are still quite a few regions in the state where Wi-Fi internet access is not always available, right? So for clinics in those locations, patients and providers alike are going to have a harder time accessing interpreter services. The same thing apparently rings true with cell phone access. So I'm hearing that there are some areas where people have to drive at least 30 minutes in order to get cell phone access from any service in their community. And so making sure that our clinics have the access that they need might be an infrastructure problem, right? You can't put a clinic in a location that doesn't have access to internet if you're expecting to provide interpreter services for patients in that community. That inherently is limiting that community's access to healthcare. Additionally, I think Missouri PQC is doing a great job at working through and offering resources in Spanish, and there's been quite a bit of discussion around how to improve our educational materials that will be able to better educate and provide resources for these families to help guide them, which will be excellent for our clinical practice providers who are trying to find ways to provide something tangible to go home with as a reminder, because we all know how much information is thrown at these families from every angle in healthcare appointments. So to be able to go home with a resource, or at least be able to access a resource online if the patient is able to, can be really helpful as a reminder.